Hi everyone, this is your friendly school nurse, Miss Kerry, and I am going to go over our COVID-19 educational staff training. So this was developed by CSNO, which is the California School Nurses Organization. What they did is they reviewed the California Department of Public Health's guidelines for school. So we're going to go through this, and I have a few videos set up as well. So the California Department of Health reopening guidelines purpose is to provide information for all staff and families on the proper use, removal, and washing of our cloth face coverings, to train all staff and provide educational materials to family in how COVID-19 spreads, the specific signs and symptoms of COVID-19, screening practices for staff and students, physical distancing guidelines and their importance, and also enhanced sanitation practices that are already being implemented at the schools. So want to prevent the spread of COVID-19 if you are sick. And we also are going over COVID-19 specific symptom identification. So that's knowing if you may have COVID-19 and when to seek medical attention. And also the workplace plan to follow when people become sick, and also ways to protect other employees and students. So the first thing that we'll go over is the proper use, removal, and washing of cloth face coverings. On June 18th, the California Department of Public Health issued a face covering guideline that all people in California must wear face coverings if you're inside an indoor public space or if you're in line to enter an indoor public space. So this would include grocery stores and schools. You should also wear a face covering if you're interacting in person with any member of the public. If you're working in any space visited by members of the public. So for example, if you are the only person in the school office, you should still wear your face mask because other people are going to be coming into the office. So you should wear your face mask at school whether or not you're alone. And then you should also wear them if you're working in or walking through common areas such as hallways, stairways, elevators, and parking facilities. There are exemptions for people who do not have to wear or should not wear face coverings. So these are any people under age 2 or people who have trouble breathing due to underlying health conditions. So if they have COPD or severe asthma. Also people who are unconscious, incapacitated, or otherwise unable to remove the mask without assistance should not be wearing face coverings. So for example, some of our students may have a physical disability that prevents them from being able to put the mask on and off safely. On July 17th, face covering requirements in educational settings were released. So at schools, anyone under age 2 does not need to wear a face covering. But students between age 2 and 2nd grade are strongly encouraged to wear a face covering unless they're exempt for a medical reason. And 3rd graders through high school are required to wear face coverings unless they're exempt. And staff as well are required to wear face coverings unless they are exempt. So now we're going to go over the proper use, removal, and washing of cloth face coverings. So in order to wear your face covering correctly, before you even pick up your face covering, you're going to wash your hands really well. Pick up the face covering by the ear or the head strings, so these little guys. You're going to loop the strings over the top of your head or around your ears, depending on how your face covering is made. You're going to put it over your nose and mouth. Oh my gosh, I have mine on upside down. So you put it over your nose and mouth like this. And then make sure that it fits snugly on the side of your face. Make sure you can breathe easily. And then after you put your face covering on, you're going to go ahead and wash your hands. So you can use soap and water, or if you don't have that available, you can use your hand sanitizer. So I'm going to go ahead and share a video.
Hi, I'm Dr. Maggie Parton, Public Health Officer for San Joaquin County. You may have heard that the CDC now recommends that people use cloth face coverings when they go out in the public for essential activities like going to the grocery store or bank. This will help keep people who may have COVID-19 but don't feel sick from passing on the virus to others. A cloth face covering can be any fabric, such as a scarf, bandana, towel, or old t-shirt that covers your nose, mouth, and chin. A face covering is different from a surgical mask or N95 respirator. These are only for healthcare workers. The CDC and the CDPH have made it very clear that the general public should not be buying masks. If you already have a mask, you can use it, but otherwise stick to a reusable face cloth covering. So I want to give you some tips. First of all, remember that your best defense against COVID-19 is still staying at home. Wearing something on your face doesn't mean that you can relax with the social distancing and hand washing. Don't let the covering give you a false sense of safety. You still want to keep 6 feet away from others as best you can, as well as wash your hands often. Those are still the most effective ways to prevent transmission. We want to provide factual information on how to use them correctly. Clean your hands before putting on the face covering by washing them with soap and water or using hand sanitizer with at least 60% alcohol. Touch only the ends, straps, or ear loops and put on the face covering by tying around the back of the head or securing the ear loops around the ears. Adjust the area around the bridge of the nose and under the chin for a proper snug fit. Avoid touching your face while you are wearing the face covering. Once you're finished, carefully remove the face covering without touching the front. Put the used face covering immediately into a bag or bin until it can be laundered with detergent and hot water and dried on hot cycle. A face covering should be laundered after each use. Discard cloth face coverings that no longer cover the nose and mouth, have stretched out or damaged ties or straps, cannot stay on the face, or have holes or tears in the fabric.
Okay, so now you have learned how to put on and remove your face covering, so we'll just go over one more time. So first thing you do is you wash your hands or use hand sanitizer. You hold your face covering only by these loops. Put it on one ear, on the other ear, and then adjust it so it goes over your nose and mouth. So, do we wear our face covering like this? No, we don't wear our face covering like this. There was a great Onion article that said, scientists have recently discovered that your nose is connected to your lungs. How amazing. So make sure that your nose is covered and that it's tied across. And then do we wear our face coverings like this? This is called a beard. This is not called a face covering. This is a beard. So this would not protect you at work as well. So make sure you're actually wearing it like this. So to remove your face covering correctly, go ahead and wash your hands. You're going to untie the strings or stretch the ear loops and handle it only by the ear loops, where this part of your mask is completely contaminated. So just pretend it's covered with filth, because it really is. You're going to fold the outside corners together, so you want the dirty side to be folded in on itself. So we're going to hide our 49er side because that's the dirty side. Be careful not to touch your eyes, nose, and mouth when removing. And if you need to put it on, like let's say you're just taking it off to eat lunch, you can have a clean paper bag and just put it in, clean side out, and then go ahead and immediately wash your hands after removing. Then when you're done with your lunch, you'll go ahead and wash your hands again. Take out your face covering, put it on without touching the outside. Make sure it's secure over your nose and chin, and then you're going to go ahead and wash your hands one more time. And then you'll want to make sure that you wash your face covering. So you should wash it after each use. So let's say you're at work all day. I usually just toss mine in the washer and dryer or my laundry basket right when I get home from work or from the grocery store. You can put it in with your regular laundry. It doesn't need anything special. You can use regular laundry detergent and use the warmest appropriate water setting for the type of cloth. So just have the water as warm as possible. And then to dry it, probably the easiest way to dry it is to just put it in your regular clothes dryer on the highest heat setting and then leave it in the dryer until it's completely dry. If you are hand washing it, you can air dry. It's good to lay it flat and allow it to completely dry. And if it's possible, if you can put it in direct sunlight. That way the heat and the sunlight can hopefully kill more of those COVID-19 germs. All right, now we're going to go over how COVID-19 spreads. It's spread mainly through person-to-person contact. So it's people who are in close contact with each other, which is within or less than 6 feet. And I'm going to go over, there are two ways to get sick through the air. One is called respiratory droplets, and one is called airborne droplets. So respiratory droplets are larger. So this is like how the common cold is spread. And then there are the airborne droplets, and that's where diseases such as measles and tuberculosis are spread. And they're very, very small. And that's why measles and tuberculosis are so extremely contagious. So what we have seen so far is that COVID-19 is spread almost exclusively through respiratory droplets. The size of the droplet has nothing to do with the size of the organism. So most diseases are caused by bacteria and viruses, which are very, very small. But it's the size of the droplet that's affecting how it's spread. It's not the size of the organism. I just wanted to go through that. If you have additional questions, feel free to contact me about that. Well, the respiratory droplets are produced when an infected person coughs, sneezes, or talks. And these droplets can land in the mouth or nose of people who are nearby, or it can be inhaled into the lungs. People may also become infected by touching contaminated surfaces, and then people might touch their nose, eyes, and mouth. So, for example, if you share a pencil or if you touch a doorknob that somebody got their boogers on, you could rub your nose and then you might get COVID-19 from that. And COVID-19 may be spread by people who are not showing symptoms. So they're called asymptomatic, no symptoms. So people might be infectious but not feel ill at all. So we want to know how to identify the COVID-19 signs and symptoms. People with COVID-19 have had a wide range of symptoms that span from mild symptoms to severe illness. And these symptoms can be different between people, and even within the same family, people can have completely different symptoms for their COVID-19. People with underlying health conditions are considered at higher risk for developing more serious complications, but anyone could have a mild or a serious case of COVID-19. So if you have an underlying health condition, you're more at risk of having severe illness, but even healthy people have been having severe illness. Some of the underlying conditions that have been linked to more severe symptoms are heart disease, kidney disease, cancer, chronic obstructive pulmonary disease, also called COPD, diabetes, and other significant health concerns. And if you have an underlying health condition, or if someone in your family does, it's a really good idea to speak with your healthcare provider about COVID-19 and your health. They may have some more specific guidance for you. So signs and symptoms usually appear 2 to 14 days after you're exposed to the person with the virus. And anyone can have mild to severe symptoms, even healthy people. In some cases, there are people that have had no symptoms but had COVID-19. So this is called asymptomatic, and these people can still spread the virus. So the most common signs and symptoms that scientists have seen so far are fever of 100.4 degrees Fahrenheit or higher, a cough, a shortness of breath, difficulty breathing, unexplained congestion, fatigue, sore throat, runny nose, muscle or body aches, headaches, new loss of taste or smell, and unexplained nausea, vomiting, or diarrhea. And you should call 911 immediately if you or someone you know is having trouble breathing, having persistent pain or pressure in the chest, if they have any new confusion, or if they have a low pulse oximeter saturation reading. So for most people, you want to have a reading of 95 or higher. I'm going to show you, this is my pulse oximeter. It's a little device. You've probably used it at your doctor's office. You just turn it on and put your finger in. And then after a few heartbeats, it will give you your results. So let's see how I'm doing today. Oh, 99%. I'm pretty good. And my heart rate is 69. So you also want to know what the heart rate is, because then that gives you an idea if this is accurate. So if it's saying your heart rate is 30, obviously this isn't going to be an accurate percentage. For most healthy people, your pulse oximetry reading should be 95% or higher. And some people may have a normal baseline that's lower than that. So people with COPD, for example, they might have a lower baseline. You should also seek medical care and call 911 if you're unable to wake someone up, or if you or someone is having difficulty staying awake, or if you have bluish lips or face. They might also appear pale or kind of a gray color. And you can also look at people's nail beds, and you can look at the inside of your lip to see if there are any changes in color. So you want that nice bright pink inside of the lip. So screening practices. Self-screening for COVID-19 is an effective way to prevent the spread of COVID-19. So employees may be asked to complete a daily self-screening tool for signs and symptoms before coming to work. So this might include taking your temperature, and also looking to see have you had any of those symptoms like unexplained runny nose, cough, shortness of breath, headache, vomiting, diarrhea. And then daily employees may be asked to record the results of their self-screening either online or on a sheet of paper. If you have any unexplained signs or symptoms of COVID-19, do not come into work. Inform HR and let them know. So it's either through your frontline absence management, or you can call or email your supervisor and let them know that you're experiencing symptoms. If you have signs and symptoms of COVID-19, you should not come to work. If you have been in close contact with someone who is either positive with COVID-19 or has been told by their healthcare provider to get tested for COVID-19, you should not come to work. So the definition of close contact is being less than 6 feet from someone for more than 15 minutes. You should not come to work if you are feeling ill or if you have tested positive for COVID-19 within the last 14 days. Do not come to work, and inform your supervisor. So ways to protect yourself and physical distancing guidelines. In order to stop COVID-19 from spreading, the best thing is to wash your hands with soap and water. That is the absolute best way. If you're not able to get near a sink with soap and water, use hand sanitizer that is at least 60% ethanol alcohol. You want to keep a physical distance from others at least 6 feet or greater, and wear your face coverings at all times when in public. And please, please stay home if you are ill. Wash your hands for 20 seconds or use the hand sanitizer until it is dry on your hand. And the American Academy of Pediatrics, AAP, recommends that caregivers should supervise children ages 5 and younger when they use hand sanitizer, just in case they decide to drink it or they're not putting it on correctly. And my daughter is almost 7, and I supervise her washing her hands because she's not very good at it. So I make sure she uses soap, and we sing the happy birthday song really slowly, because even though she's almost 7, she really needs to be supervised. So we need to keep an eye on our own kids and our students as well. So COVID-19, when to wash your hands, these haven't changed since the beginning of time. We should always be washing our hands in these circumstances. So before and during preparing food, before eating, before touching your face, before using the restroom, before putting on your face covering, before treating a wound, and before changing diapers or caring for someone else. Again, we wash our hands after we prepare food, blow our nose, cough, or sneeze, after we touch our face, after we use the restroom. Please tell me you've always been doing that. After removing your face covering, because like I said, that front of the face covering can be contaminated. After treating a wound, after changing diapers or caring for someone else, after touching an animal food, or animal waste, after touching garbage, and when you come back after being in public or coming home from school. So what I do is when I get home from the grocery store or from work, the first thing I do is I carefully take off that face mask, throw it in the laundry, and then I go straight to the sink and wash my hands really well. And then I watch my daughter do it. So we're going to go over how to wash your hands. And I found all these wonderful videos that I think you guys would probably like to share with your students. So I'm going to go ahead and play some of these with you, and I'll give you the links to all these videos as well.
What you need to know about hand washing. Why should I use soap and water to wash my hands? Germs can get on your hands and items you touch throughout the day. When your hands might be dirty, it's best to wash with soap and water to remove whatever germs and chemicals are on them. Warm or cold water. Either is fine, as long as it's clean. Bar soap or liquid. Either is fine. Does the soap have to be antibacterial to work? No. Plain soap and water work just as well. What if I don't have soap, but I have access to water? Using soap to wash hands is more effective than using water alone. But if water is all you have, rub your hands together under it and wipe off with a clean towel or air dry. When hands aren't visibly dirty, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. How long do I need to scrub when washing my hands? Scrubbing your hands for at least 20 seconds is most effective. Do I have to clean under my fingernails? Yes. Germs like to hide under fingernails. Make sure to clean there too. Towel or air dry? Either is fine, but if you're using a towel, make sure it's clean. Should I use a paper towel to turn off the faucet or open the door of a public bathroom? There isn't much scientific evidence about this. If you're concerned about getting germs on your hands after you wash them, you can use a paper towel to turn off the faucet or open door handles. What if I don't have soap or water to wash my hands? If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hands, but may not kill certain bacteria and viruses that cause diarrhea. You should wash your hands before eating or after using the restroom. Protect yourself and others by washing your hands with soap and water. Learn more about the magic of hand washing. Visit cdc.gov/handwashing.
This is something that might be fun to share with your students or either some grown-ups you might know. I'm going to start the video in the middle because they're doing a fun exercise.
Sounds great. This blue paint represents germs that we can't see. The three of us, myself, Sarah, and our friend Jackie, will put the germs on our hands. I'll wash my hands with water and soap. Sarah will wash hands using only water, and Jackie will try to get the germs off without soap or water. We'll start at the same time, and whoever has the cleanest hands after 20 seconds wins. Ready? Set? Go. Time's up. Can everyone show their hands? Okay. I think we have a winner. I washed with soap and water, and I got all the germs off. Sarah, you washed with water only. Looks like you got a lot of the germs off, but there are still some hanging out. Jackie, wow, you're still a mess. We need to get you some soap and water to get those germs off. Obviously, you can see that washing with soap and water gets more germs off faster.
I think we all know that poor kid in the middle. And then I also have one more video to share because this one shows exactly how to wash your hands.
Get rid of these germs and chemicals. CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a cloth nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dryer. Washing your hands using the steps we just demonstrated is very important to get hands completely clean.
Okay, and so how to wash your hands with the hand sanitizer. So you're going to go ahead and pump that into your hands. I'm going to do that off screen. So you put on the amount that you have. Make sure you cover your entire hands. Get in between your fingers. Wash, scrub, and you're going to go ahead and scrub. Get your wrists. And you're going to scrub and scrub and scrub and scrub until It's completely dry. I think I put a little bit too much on. So they said it should take about 20 seconds, so that's singing happy birthday twice. All right, nice and clean. Okay, so another way to keep safe is to practice physical distancing. We all know all about this. We're going to stay 6 feet apart from each other. In our classrooms, we're going to arrange the desks to be 6 feet apart. You can arrange or stagger grades or students for classrooms, and you can stagger the arrival and departure time so that there's not a big group of people all standing around waiting for cars. Designate entry and exit points. That way you have people going in one door and out another door instead of all these people coming into one small space. Minimize crowds as much as possible. Small groups of kids are allowed in the library or other locations. And then avoid crowds where physical distancing is not possible. We also want to promote physical distance on the bus between students and the driver, and between each student. Keep the windows open on the bus to promote ventilation. Check HVAC systems in the school building for clean filtering systems, and then also keep classroom windows and doors open. And you also can do this in offices as well. That way you're increasing that airflow, and so if someone does happen to spread the COVID-19, that increased airflow is going to move that outside, and so people will be less likely to be exposed to it. The most important thing is to stay home when you're ill. If you have signs or symptoms of COVID-19, if you've been in close contact with somebody who either tested positive or their healthcare provider suggested they get tested, if you are feeling ill, or if you have tested positive yourself, stay home, and you may be asked to self-quarantine or to isolate. So isolation occurs when you are COVID-19 positive. So your healthcare provider or the public health department will tell you to isolate. And that's going to last for 10 days after your symptoms first appeared. And on the 11th day, you can return to activities as long as your symptoms have improved and you're fever-free for more than 72 hours. So that doesn't mean you're fever-free because you took ibuprofen or acetaminophen. So it means that you're actually fever-free. And so it's going to be, the easiest way to remember it is that it's 10 days after symptoms first appeared or 72 hours without symptoms, whichever is longer. And during that isolation period, you're going to rest and stay hydrated and stay away from others. You may need a friend or family member to drop groceries off at your house. They can just put them on your doorstep and then ring the bell or give you a call to let you know that they left the needed supplies for you. And it's also a good idea to check in with people every couple of hours. When my sister tested positive for COVID-19, my brother and I called her every 2 hours during the daytime just to make sure she was okay, to see how she was breathing, because we just wanted to make sure she was safe. Also, you may be placed into quarantine, which happens when you've been in close contact with somebody who either tested positive or was told by their healthcare provider to get tested for COVID-19. So quarantine lasts for 14 days since your last exposure to the above person, and you should also consider getting tested for COVID-19. Throughout those 14 days, you're going to be monitoring yourself for signs and symptoms of COVID-19 for at least twice a day, and you're going to stay away from others. So same thing, if you do need supplies, reach out to family or friends to drop off any supplies on your doorstep, and then they can call and let you know that they left them for you. So here's a calendar that gives you an idea of what quarantine looks like. So we're going to pretend that this is August 1st was their last close contact with the person who has COVID-19. So August 2nd is going to be day number 1 of quarantine. So we count up. So August 15th is going to be your very last day of quarantine. So let's say your quarantine started at noon on August 2nd, then it's going to end at noon on August 15th. And that can be kind of confusing. So usually the public health department will give you really specific dates for that. And then if a student or staff member is positive, a lot of times the public health officer will contact me or Nurse Leanne, and they will give us the exact dates that a student or staff member can come back. So we all try to stay on top of it just to make sure you guys are safe. And there's also guidelines on cleaning and disinfecting. So our wonderful custodial staff has been cleaning high-touched surfaces, not even daily. I'm seeing them cleaning them throughout the day. So it's wonderful. They're really working hard to keep us safe. So you want to make sure that desks, light switches, tables, door handles, doors, phones, keyboards, toilets, countertops, faucets, sinks, handles, tablets, computer mice, not your real mice, chairs, and bathroom surfaces are cleaned at least daily or more often. So a big thanks to our custodial staff for keeping us safe. Also, ways to limit COVID-19 from spreading are to limit sharing of supplies. So try to have your own office supplies. And when kids return, make sure they have their own supplies that they use. I wouldn't use the water fountain at all at this point in time. Bring your own water container from home. Identify activities that have less contact with high-touched surfaces. So some playground equipment might be off limits for a time. You wouldn't want to play a sport like basketball where people are going to be in close contact with each other and sharing the ball, but you could have a game where each student has their own basketball and they're practicing dribbling and shooting. So you just want to keep in mind you can modify all sorts of activities so that they have reduced contact between people. And then we should also clean school buses daily. And then our custodial staff, when choosing disinfecting products, they're going to be choosing things that are on the EPA approved list N and follow the product instructions. And to reduce the risk of asthma and other health effects related to disinfecting, programs should select disinfectant products on list N with asthma safer ingredients. So these include things like hydrogen peroxide, citric acid, or lactic acid, as recommended by the US EPA Design for Environment program. And then these are the references that CSNO used for all the content in this presentation. If you have any questions, definitely contact myself or Leanne for any health-related questions. Your administrators are great sources of information. Thank you so much for attending our presentation today. I hope you have a great day. Thanks. Bye.